It's clear that we are not out of the woods yet. More testing and more results are required for us to be confident in making a decision to lower alert levels as part of this process. The last thing that we want to do is find ourselves moving in and out of alert levels unnecessarily. We do know that the more we do that, the more uncertainty there is for people and the higher the consequences of that for business and for people. So we have, Cabinet has agreed with the recommendation of the Director General and myself that we extend our Level 2 restrictions in Wellington for a further 48-hour period up until 11:59 p.m. on Tuesday. The rest of New Zealand remains at Alert Level 1. We ask people to remain vigilant and continue to follow the advice of health professionals. And most importantly, we want people potentially connected to our case who are unwell to come forward and get a test. All the people connected to the case to come forward and get a test, and all the people who are unwell to come forward and get a test. Some additional information has also come to hand, which the Cabinet considered. New South Wales health officials confirmed yesterday that the household contact, the partner of the case who was travelling with them when they were in New Zealand, whilst initially testing negative, has subsequently tested positive for COVID-19. That shows that Case A was able to transmit the virus, and it suggests that Case A was infectious towards the end of their stay in New Zealand. Those two people were isolated from each other on return to Australia, given Case A's positive test result at that point. So the infection could have taken place in New Zealand or while they were travelling back together. So we are now particularly focused on those who could have been exposed to Case A towards the end of their stay here in Wellington.